So good afternoon, Derrick. How are you?
I'm well, thank you.
So I'm here with Derrick Murray. He's the Chief Operating Officer for Syracuse Community Health Center, which is certainly on the front lines during the COVID-19 crisis. Derrick, tell us a little bit about your role there and what the health center is doing right now for the community.
So as the Chief Operating Officer, I'm responsible for all of the day-to-day operations. That's inclusive of the delivery of care, who we have delivering care, how we deliver the care, and all the regulatory components that go along with that. We are a New York State Department of Health licensed entity, and we also have a federal designation. So I'm the person who's supposed to keep us on the straight and narrow with the state government as well as the federal government as we fulfill our mission.
And what my understanding is that that was one of the first testing sites in our community, and one of the first testing sites to go to where you could test through while people stayed in their vehicles instead of coming in. Can you talk a little bit about your efforts around testing and how you're servicing the community in that
So I would say to your point about being the first, outside of New Rochelle, which is downstate, just north of New York City, we were the first drive-through testing facility. And New Rochelle obviously was a community that really had the first outbreak here in New York State. And then the city kind of deteriorated from there. New Rochelle was also the community where the governor had deployed the National Guard, and they built a perimeter around the city, and they were testing in and testing out and making sure that they were kind of isolating who had COVID-19 and who didn't, and obviously getting folks out of the community and isolating them if they tested positive. So we stood up. We started our planning in early March, and we stood up our response as of March 15th. And it was still very new throughout the state. This has been a very fast-moving process. So as we stood up our response, we were getting real-time information out of folks who had either been down at New Rochelle testing and things like that. And that's how I think we've been able to stand up a quick response. We've tested almost 5,000 individuals through this process. We also have, and I'm looking for wood to knock on, none of our employees or volunteers have gotten sick. We've really, from COVID, so we've really focused heavily on infection control, having the right PPE available, and really, I would say doing an outstanding job of making sure that we focus on the safety and health of our employees and volunteers. I would say, and maybe I'm biased, but I believe we have better PPE stores than most of the hospitals in our community.
Wow.
And so we've worked with organizations that want to donate to us. We're also, again, a county testing facility, so we've worked closely with the county to ensure that we have all the necessary PPE available to test safely and quickly.
You talked about the fact that this has moved so fast, that you scaled up so quickly. You've done things that you haven't done before, so you've done things for the first time, and there's such an emergent need behind it. There's such this feeling of urgency around your work. So I assume that it's also, but you also manage to, keep your employees and your volunteers safe. So there's a certain amount of humanity that you must have to bring into the job every single day to keep at the forefront of being responsive to these, this urgent need, but also making sure that you're realizing you have people's mothers, fathers, sisters, uncles, brothers, working there on your front lines, and there's families and stories behind this front line. So talk to us a little bit about how you keep that at the forefront of your thinking when you're trying to be responsive to all these needs.
So we were speaking about being Jesuit trained, and I, there's not a thing I do without really focusing on doing all things for the greater glory of God. Spending any amount of time in a Jesuit environment, you kind of get that beaten into you. Sometimes physically, but definitely from a didactic, mental perspective. That we're not just here to move around and do things for what's good for me, myself, and I. Really, we should be thinking about how we use our time, talent, and skills for the betterment of our communities and the people we work with and the people we service. And I also subscribe to a servant leader model. So I typically don't ask people to do things I wouldn't do. In the last 7 weeks, I've been off for 3 days, and I wouldn't say they were 3 whole days, because my staff is here night and day, 7 days a week, and if they need something, I have to be available to them. And so that's something that I really feel very strongly about, and that's something that we try to live into, being servant leaders.
And I know that you probably feel that way about your family first, just as you do about, your family at work. So talk to us, I know that you've had one of your daughters, your oldest daughter has graduated from Bishop Ludden, and I know that you have a daughter who's a freshman there now. When you were making decisions as a family, as parents, why did you choose Bishop Ludden?
So for both of our daughters, they both went to St. Margaret's in Mattydale, a small parochial school, very close-knit. The colors were green and white, so that may have played a role in them ending up at Ludden. But we gave our daughters the option. They both gravitated towards Ludden because I believe the small class sizes, the very personable approach that Ludden takes, and our daughters are more modest. They're more focused on really how they can be better people. Both have excelled quite well. Our oldest graduated as the salutatorian for her class.
Oh, that's great.
So she excelled in every way, shape, or form she could, and that really translated into an excellent presidential scholarship for her at Loyola Baltimore.
Wow, great.
Where she's excelling and having fun, having the normal stressors that a freshman might have during their first year, but has really excelled, and she's been employed as a lifeguard at college. She's going to be an RA next year. So there's a lot of great things that she's been able to parlay her experiences in high school towards.
That's great. That's really nice to hear. And your daughter, who's a freshman right now, talk to us from a parent's perspective on how the school reacted to the crisis. Everything from their communications to being innovative in how they're delivering education. What's the feedback that you would give them and other parents?
Well, I think so my background is public health, and obviously there's been a lot of public health guidance and directives that have come down from the state government. And one is the closure of schools. Obviously that's a pretty draconian approach to addressing something that's going on in the community, but it is something that's necessary. I, like most people, never thought we'd be homeschooling our children. It's been an interesting endeavor. We also have a 6-year-old first grader. Yeah. So he is like a wild child, whereas Tess, who's our freshman, she's had an enormous amount of coursework to do online, and so I think Ludden has done a good job of embracing online learning. I did one of my graduate degrees online, and I did one in a traditional setting. And I'll tell anyone, any day, anytime, that it was easier to go to a class and look your professor in the eye and look at your colleagues and your friends. That's easy. To have to be self-directed, self-driven, using technology, being at home with a 6-year-old brother, 18-year-old sister, everybody on different schedules.
Yep.
My mom also working from home, who's a public librarian. So,
Yep.
Knock on wood, we have a house large enough that folks can kind of find their own space, but it is not an easy endeavor. So I have to give Tess, my 14-year-old, her props, because she's keeping up with the work. But I would just say, from my perspective, I think Ludden has done an excellent job in using this new delivery system of education. It's not easy. I've also taught college online, and so now I can put myself in the shoes of the teachers. It's not easy teaching students online, and it's quite difficult. And so I think everybody has really risen to the occasion. But I trust that things will ease as we go forward. I'm hoping, at least from a parent's perspective, that we get back to some level of normalcy, whatever that is, as we go through the summer and come to the next school year. But I'm, now I put on my scientist hat, and I think that, there may be some hurdles that we have to jump over in order to make sure, the disease is controlled enough in the population. We don't have any hotspots or flare-ups and things like that. And if we do, we have a good response towards those.
So it sounds like you want to be optimistic, but you're also being a little bit conservative, because you know that we have to be careful, and so you're going to approach your work in that way. What do you think is, if you were to share with the parents of Ludden, other people who might be watching, what would you say has been the benefits of this experience, for on a human level? Like, what is it that that has been a real positive for either you or your family during this time?
Well, I will tell you that as my oldest was in her senior year, we didn't see her for the last few months of high school. She was working around the clock as a lifeguard at the Fayetteville Y, and so I see my children more now than I probably saw them when they were little. I was I was studying, I was all, away at business, et cetera. So the amount of time that we all see each other has um, increased significantly on a daily basis. The amount of communication that we have with one another has increased significantly. Sometimes that communication is difficult. It's fighting, but at least when you look back, I trust that my children will say, "Hey, do you remember the spring and summer of 2020 where we were around each other 24/7?" And they gain an appreciation for each other. Um, I think that our lives get so busy normally that we forget what's important. And I think you and I were talking about having dinner together, going on walks or bike rides afterwards together, and spending quality time. We have several TVs in the house. They're not on a lot, so there's a lot of dialogue that goes on, a lot of interactions. So I would just hope that everyone could find some of the value in this time of close proximity with our families. Now, social distancing on the other side, I think that there may be some societal issues related to that, really accentuating depression and loneliness, chronic loneliness, which people talk about as being something that's somewhat academic, but there are a lot of people who just don't have daily contact with other folks,
Yeah.
and that contributes to mental health and other mental ailments.
Yeah, I think you're right. I think that we for those of us, who are getting more time with, those that we're closest to, we're grateful for that. We recognize that. And also at the same time, you can understand that this is, creating an environment where, those who are not as fortunate to have, strong family units, can be suffering more than they would on a normal basis. And so it's good to keep that at the, in our thoughts. And so anyway, Derrick, I'm extremely grateful for what you're doing and what your team is doing for the community, and for leading the charge on that. And and what you're doing, within the Ludden community, being a patient and proactive, parent, and taking, part in your kids' education, because you understand that it's they're doing something that they haven't done before, but you think they're responding well, and that you're playing a part too to lift it up to the best level it can be. So I appreciate everything, and taking the time to chat with us today. We're grateful.
Thank you. Thank you.